So my name's Monica Cuneo, and this is Leanna Haywood, and we are here to talk about the developmental origins of health and disease at an emerging collaborative called the Food is Hope, Food is Health Collaborative. I work with Portland State University at the Institute for Sustainable Solutions and their Center for Public Health Studies, and I'm going to let Leanna introduce herself.
Hi, I work at OHSU with the Moore Institute for Nutrition and Wellness, which is a fairly new institute. We've been around about 3 years, and that was started with a gift from Bob and Charlie Moore of Bob's Red Mill. And it's really looking at reducing the prevalence of chronic disease across the lifespan in current and future generations by promoting healthy, nutrient-rich diets, specifically among women who are pregnant, thinking about becoming pregnant, and through early childhood.
And some of our colleagues, as well as Leanna and I, are working closely on how the two universities can collaborate better to be able to address the developmental origins of health and disease, as well as with outside partners. So we're really excited to be here. We're going to have a conversation. We really want to emphasize the conversation part around the developmental origins and how it can serve as a framework for understanding community health. We're also here to share some of our knowledge and the research that both of our universities and partners produce, as well as to listen to you all about some of the information that you are bringing to the conversation. So we're going to have around 75 minutes together, not around, probably exactly 75 minutes. And we're both going to be facilitating different aspects of the conversation today. And we're hoping to achieve these outcomes over here. And sorry, we don't have a lot of good wall space, so this is probably unreadable to many of you. But we're hoping to introduce the developmental origins as a framework for understanding community health, to introduce the science behind the developmental origins just enough, but not too little because it can get complex really fast, to consider the potential implications and application of the developmental origins in your life and in your work. Excuse me. To share the work of an emergent collaborative, which I called FH2, which is shorthand for Food is Hope, Food is Health, because that's a mouthful. And to hear thoughts and ideas from you guys on strategies on how to translate the science of developmental origins into action. And we're going to share some of the work that we're doing around that. So we're going to spend around the first 10 to 20 minutes providing some background on some of the science and around the collaborative. And then we're going to ask you guys some questions both in a large group format, some talking to each other, and then there'll be, at the end, a time for you guys to do a little bit of individual reflection, which is what these cards are for. And the hope is that I will be able to collect these. So if you write your grocery list, I'm going to take it with me. And what was that?
Will you shop for me?
Oh, I don't know. And then we'll head to lunch. So again, we want this to be a conversation, so if you guys have questions or comments throughout, please feel free to pipe up. And I think that's it. So
One other caveat I'd like to make, neither of us are scientists or researchers. We're public health people. So we are giving you today sort of the high-level overview of the science, and we'll answer as many questions as we can, but in-depth questions, we may not be the best people to answer those for you.
we can try to connect you with
With someone who can, yes.
Sounds good? Okay. So a recent report from the Robert Wood Johnson Foundation said that our zip code may be more important than our genetic code in determining our health. People heard this? Heard it this morning? Well, I missed that. So what does this mean to you? And I want to hear this out loud.
Like somewhere you live in kind of property area or community, I don't know.
This somewhere where you live?
Yeah, I'm not sure.
So it means that it refers to somewhere where you live.
Uh-huh.
Yeah. Somebody else. What does this mean to you? When you hear this,
Some neighborhoods are nutrient deficient.
nutrient deficient.
Or rich in toxins.
Say that again?
Or rich in toxins.
Okay.
There are place-based inequities.
Place-based inequities. Keep them coming.
Is it actually the zip code that you were born in?
That was what we said this morning.
Yeah, so, where you are born, like, what you're exposed to early on in your life, may have profound implications for health.
Okay. So I hear about the question,
Yeah, I just wanted to clarify if it was that, or.
a question as well as, so question around early life exposure or not, or
Right,
something else.
right.
Can place stigma on top of stigma.
Can you say more about that?
You have stigma because of the color of your skin. You
Hmm.
have stigma because you're a single parent. I
Hmm.
mean, you know, and now you're this zip code. Well,
Okay.
you know, here, have another barrier
Another barrier.
to break through.
Did I hear something else?
She just added compound barriers.
Compound barrier.
And it changes how you think and feel about yourself.
Okay.
Access to community services.
Can, okay.
Exposure to violence
Hmm.
or safe neighborhoods.
Hmm. So that could be implied within the zip code.
It can increase the risk of diseases due to the lack of access to healthy foods, fruits, vegetables, those kinds of things.
So increase the risk of diseases due to lack of access to resources and nutrients.
Right.
This is great. I don't think we need to do a session anymore.
Kind of one aspect for me is that it actually is almost a hopeful thing because it's a very tangible thing that we can tackle, you know, it's something we can look at and address because it's, you know, discrete things that are happening that we can identify.
Great. Actually, I think, okay, I'll take you too. Go ahead. I pointed at both.
That health is community-based, not just individual-based.
Now, I really only have one for
Okay.
room for one more.
Just the observation that we've learned in our region that zip codes can change their economic character, their access to services. The people who lived there when they were disadvantaged sometimes find themselves unable to stay in the neighborhood as it improves. And so another zip code becomes a location of poverty as folks are forced from a neighborhood where services, access to food, access to better schools has improved. And so there's a wealth and family or household access issue as well as the zip code, because you may be forced into another zip code where conditions deteriorate or
Right.
are never very good either.
When communities improve, it can lead to
Yeah,
displacement
Displacement.
of the initial. Okay, that's great. So you guys have touched on a lot of the topics that we were hoping you would, so great job. I'm going to let Leanna take over and go over some of the background and the science that really helps to underpin many of the comments that you have already made. I can help you with your slides. Ooh, sorry.
So
So we're gonna start today with a quote from David Barker. Does anybody know who David Barker was? Maybe? Okay. I'll tell you who he was in just a minute, but let's start with the quote. So this is, the prevailing wisdom had been and continues to be that heart disease is a result of behavioral choices that lead to obesity, such as a high fat or high sugar diet, sedentary lifestyle, or smoking. The answer to their health and chronic disease was not going to lie in the way that people lead their lives as adults. So David Barker was, he just died last August, pretty recently. He was a professor at University of Southampton and at OHSU. And he was looking at health inequities in England and was the first person to be able to articulate a link between low birth weight and risk of dying from cardiovascular disease. And he'd found birth records from the early 1920s in England and was able to correlate those with, match those with death certificates, and found a risk of dying from cardiovascular disease if you were born with a low birth weight. This was originally referred to as the Barker hypothesis, but it is now accepted science, and most people refer to this now as developmental origins of health and disease, or DOHAD. You hear quite a bit too, because you know we love our acronyms. So developmental origins of health and disease describes how social mechanisms induce biological changes that create risks throughout the life course. So these slides are small, but they're not surprising to anybody in this room. We know that the health of the American population has been on the decline in the past couple of decades. We have increasing rates of overweight and obesity, of uncontrolled hypertension, of diabetes, and those lines are just going up. And we know that these are all risk factors for developing heart disease and stroke. Prevailing wisdom kind of had been that our genetic code and our lifestyle set our risk for developing chronic diseases like heart disease. But we now know that our genetic code is not a rigid blueprint for our health, but is a set of infinite possibilities that can be switched on or off dependent upon the nutrition and environment that our mothers experienced when they were pregnant with us, and with the health we received when we were young. For about the first 1,000 days of life is what we talk about within DOHAD, which is from conception to about age 2. So there are two key components of the developmental origins of health and disease, and that's the poor nutrition piece, poor nutrition before pregnancy and from conception through the first 1,000 days, and chronic stress, the level of toxic stress brought on by conditions such as racism, inadequate housing, unemployment, and lack of opportunity can affect your risk for disease throughout your life course. So this is, how many of people have heard of epigenetics? It's kind of the buzzword everybody's been sort of talking about lately. Developmental origins is based on this idea of epigenetics, that literally means sort of above or on top of your genetic code. It refers to external modifications to DNA that turn genes on or off. These modifications don't change the DNA sequence itself, but they instead affect how the cells read genes. So for example, epigenetics has demonstrated that certain kinds of chronic stressors accumulated through time and through various exposures can cause that on-off switch to flip on and sometimes last throughout generations. So in other words, the developmental origin is kind of where nature and nurture meet. This is a graph just showing birth weight in U.S. populations across the entire population since 1990 here has been on a steady decline. And these are these are showing different weeks of gestation. DOHAD specifically is looking at full-term infants, the birth weight, so it's not like, oh, well, you're a 5-pound baby, but you were 2 months early. We're looking at full-term births. There's a related set of data that fits with preterm infants as well. But we know that low birth weight can serve as a proxy for measuring our developmental health in utero, and that the growth trajectory that is set in the womb sets foundation for health across the lifespan. This is David Barker's J-shaped curve that is showing an inverse association between birth weight and chronic disease. We know that full-term babies born at lower birth weights have higher risks for dying of chronic disease. Birth weight has also been linked to development of type 2 diabetes, obesity, hypertension, osteoporosis, asthma, and even some forms of cancer. So how you grow before you're born really matters. And this idea of fetal programming implies that during critical periods of prenatal growth, changes in the nutrition or hormones experienced by the mother may alter the full expression of the fetal genome, leading to permanent effects on a range of physiological functions and structures. So what this is really saying is trade-offs are being made in the womb. We know that the brain is going to grab everything first, and so then the other organs may be less developed at birth. Sorry, not less developed. May be sacrificed a bit because the brain and others are prioritized. So how many people are kind of looking at this chart and thinking, oh man, I was 6 pounds at birth, or I have a child who was 6 pounds at birth? Yeah, it's. Let me just talk so I can take that stress down a little bit. So let's just remember that risk is not reality, probability is not certainty. Let me switch slides for me. So stresses that are experienced in the womb, virtually all of which have roots in the physical and social environment, alter the structure of organs in the fetus, thus changing the expression of regulatory genes throughout the lifetime. Together, these two processes lead to vulnerability for disease later in life. So we know that the nutrition and stress women experience during their pregnancies creates that initial vulnerability for developing later disease. However, there's also this idea of a second hit, which results from the quality of the environment of the child after birth. So the quality of life that we're all surrounded by right now, the stresses that we're facing and the nutrition that we are getting now. So it determines the second hit is critical because it determines whether the initial vulnerability formed in utero will manifest itself as later disease. So just because you're born at 6 pounds does not mean you are going to die of heart disease. There we go. So we've talked about the nutrition and stress during pregnancy, but there's another piece of DOHAD, which is the piece that I find incredibly fascinating, and it's the intergenerational effect that this can have. So the egg that made you was formed in your grandmother when she was pregnant with your mother. Because we know that all women are born with all the eggs they're going to ever have. Okay. So if we think about it, the egg that ended up being you was made while your grandmother was pregnant with your mother. So that was however many, many years ago that was. So the environment that your grandmother experienced, the stresses that were a part of her life, the food that she was exposed to and ate, has a direct effect on you today and your risk for developing chronic diseases. And in turn, what you are doing today may have, and if women in the room who have children are going to have children, what you're eating and the stresses that you're experiencing are going to have a direct effect on your grandchildren. So we can see this intergenerational effect that keeps going, and we can kind of see how just making a change right this moment may not affect us, but it will affect the next generation. I think that's my piece. We're on to Monica.
Don't worry, we'll have time to unpack this. I know it can be some intense information. So, no, thank you. So what Leanna was just describing is how the social environment, which is what we commonly refer to as the social determinants of health, literally get under our skin to create biological changes that can have an enduring adverse impact on health and opportunity throughout the life course and for future generations. So the science around epigenetics really underpins what I believe many communities have known through their own lived experience, and that's that the distribution of health and disease in our society really isn't random, and that the social determinants of health are in a dynamic relationship with our biology that ends up making some of us more sick than others. So because of this, we are very, very deliberate to emphasize that this is not we're not suggesting a behavioral health approach. We are targeting the behavior, or we're also not targeting the behavioral choices of mothers or women, but we are targeting the community and the broader social environment that works to support or not support the health of communities. In an article in Nature in 2014, they reported that many of the intrauterine stressors that the developmental origins identifies as having adverse intergenerational effects correlate with social gradients of class, race, and gender. So this points to the need for societal changes rather than individual solutions. So to put it simply, while the mother may be the environment of the developing fetus, the community is really the environment of the mother. And the social environment is the broader context for all of them. And what this implies is that we really have a shared responsibility in creating community health. So in order to really move the dial on any of this, we really need to move our efforts, we need to shift our efforts in very dramatic ways. We need to recognize that health is really interconnected with all other sectors. And I know that that's what brings us to this summit, is recognizing all of the different players in creating and improving equity. But health needs to link and leverage with community health clinics, housing, early childhood education, nutrition, food access, social justice movements, and more, to really be able to prevent the chronic diseases that we're talking about today and reduce social stress. We need to think bigger, bolder, and really more comprehensively to apply our scientific knowledge that Leanna laid out and integrate it in with community-based efforts that we see happening and that we participate in. And then we also need to consider some of the social policy approaches, and really what was highlighted here, that this is tangible. There is some hope here, because we have some more targeted ideas of where our interventions should occur. And so we can work on things collectively, like supporting minimum wage laws and anti-discrimination policies, because as we have already talked about, the social environment really, and the access to nutrition and resources, really affects our health and our genes. And then we also need to consider, what would it look like if Multnomah County or our region or our neighborhood was really the best place to have a child? What would that community look like? What policies would be in place? Who would need to be part of the conversation? How would we really mobilize political action? So this collaborative, the Food is Health Collaborative, is trying to answer and work on some of these issues. So we're an emerging cross-sector, multidisciplinary collaborative of over 20 different community partner organizations with the mission to really increase the nutrient level of the entire community, to create food systems that can be engines of economic development, and to strengthen the existing support networks in the community to support women and children. And then we have the overall goal of creating the momentum and the sense of urgency necessary to really urge partners to move outside of their cylinders of expertise and excellence, otherwise known as silos, to try to really create cross-sector and innovative solutions to try to bridge this world of immediate short-term needs that's absolutely necessary around service delivery with long-term strategies and approaches. And the few ways that we are trying to do this are through these methods. So we are linking and leveraging existing and new resources. So this includes community engagement, convening community partners that want to have be a part of this conversation and need to be, and helping to facilitate our collaborative partners in building and expanding on their current efforts, as well as generating shared goals between everybody. We're working to build the capacity of communities, organizations, agencies, governments, anybody that kind of has their hand on the elephant, so to speak, so that multiple audience really understand their role in addressing the developmental origins. We are translating the research, which again can get kind of heavy and intense, for community partners to be able to use in the work that they're doing. So how can they apply this framework to the work that they're already doing? And then providing training and tools and technical support and being able to really frame these issues so that we can work on advocacy together and try to really move the dial. And then finally, really leveraging some of the resources that exist both within PSU and OHSU in terms of evaluation and research and community-based participatory research to generate more evidence-based practices and actually establish some metrics so that collectively we can start to assess our progress over time. So, now we're going to have some time to digest this information. So, how are people feeling? You ready to talk? So, I'd love to hear from you. And I know just want to remind you, there's no right answer to this, but just tell me one thing that you think is the most important of what you heard. What really stuck out to you as the key piece of information?
That the influences are intergenerational, that just blew me away.
Yeah. Did you know about the grandmother?
Did not.
No.
That stuff.
I'm thinking about where my grandmother lived when she.
Yeah.
This is very personal when you hear this, isn't it? It's, identify.
That your personal health behaviors really can only go so far to determine your health.
Yes.
That intervention really has to happen at a cross-sector level.
Cross-sector interventions. Comprehensive. So what was confusing?
The one thing that I kind of stuck on is the culturally appropriate food options, and I'm wondering, I've definitely seen that in action as really well-minded people come in like, oh, we're gonna build a community garden, and why isn't the neighborhood using it? And I think that's something we need to think about really hard.
So some of these like
Wondering how to-
geographic fixes around food access that may
what
not
that
be
looks like.
integrated with communities. Okay.
Why is impaired brain development not listed as a consequence of low birth weight?
Why is what?
Why isn't
Why is it?
impaired brain development listed as a consequence of low birth rate?
So that felt confusing to you that wasn't on
It
the list?
is.
Oh.
I mean, it is one of the consequences. I think just with us trying to keep to the very highest levels, there's all kinds of other sub things that can be listed under there.
The brain development is pretty key.
It is, but when we're talking about the nutrition and the stress, what you're getting is gonna go to the brain first. But we know that there is still that consequence that absolutely results in cognitive impairments over the lifetime. So I will not disagree with you there.
So you feel like it should be more front and center?
Right, because a lot of the nutrients that mothers consume, contrary to science, do cross the blood-brain barrier and do directly affect the developing fetal brains.
One of the things that worries me most is dealing with environmental issues that can change the genetic code, such as flame retardants, and how underspoken that is in our environment and in our communities, and for folks that are, of different races and people of color in low-income situations. So just, placing things on a determinate conveyor belt, per se, based on your grandmother's history is just one element of all the different factors that go into what your mother is experiencing and then what you experience as a child within those 100 days.
Right, and I think that's a good point. And environmental toxins is certainly one of the 3 contributing factors of the developmental origins. Although Leanna and I were talking about this yesterday, it's kind of the area with the least amount of science at the point. So a lot of the research has gone into the social, the toxic stress, and the and nutrition.
What drives me nuts is they're talking about the endangerment of fish downstream.
Mm-hmm.
Right now, it's come out that, you know, we have a large amount of endangered fish that are being contaminated because of this pollutant getting into the system,
Mm-hmm.
just washing off our skin. But we're not talking about what our children are experiencing by just crawling around in the dust.
Okay. So what else was confusing to people about what you heard?
I think I always really have this existential confusion around like being told my whole life, or like just change your behavior, like change your habits, like that's how we're gonna change the world is by recycling. Yeah.
Yoga and
Yeah, exactly. So like meditation, and obviously that's not what's that's not what's ultimately gonna be effective. So then how my personal behavior, what of my personal behavior in terms of like civic engagement and conversations that I have with people, what does change that's actually effective?
So how can individually you still have impact,
Yeah.
not only on your own health, but maybe broader health as well?
Yeah.
I think for me, something that's confusing, I don't want to be catastrophic, but
Here it comes.
is the hugeness of this on an international level when I think about policies that bomb children and villages and families. And how do we connect that dot with what we're doing intergenerationally around chronic stress and our policies on every single level?
I will just say that the Moore Institute is hosting an international summit next May, and it's going to be about 50% U.S. people who are working in the field of DOHAD and in nutrition policies, and then 50% are going to be leading sort of people who are it is focused on nutrition, implementing nutrition policies in developing countries, to come together and kind of look at policy type issues in developing nations.
But just to comment on that, because I think that that's really, it's a fascinating way to kind of link the two worlds together. And how are we looking at the effects of war on long-term health? And one thing that we talk a lot about, or that we have talked a lot about, is what has happened in the U.S. around historical trauma within the African American population. And that really, if we look at only 3 generations to 4 generations ago, if we're talking about our grandmothers 3 generations ago, that we are not far from Jim Crow laws or from slavery. And so we're looking at, we're looking at health outcomes that are affecting whole populations. You can tie it back to theoretically you can tie it back to some of these events.
Can I just add one other international thing? It's just interesting that the Israeli government policy in besieging the people of Gaza, one of the things they do is actually keep a calorie count. What's the minimal number of calories that we need? And so what does that mean long-term on a public health, for the public health of people?
At least we have data to look at it later. So I'm going to ask one more question, and then we're going to move on to our next section. But which question I want to ask you? What does this, I'm going to combine 2. So kind of what are the implications of this, and what does this change for you, hearing some of this information?
To me, one of the things that was kind of not confusing but just confounding is I understand what happens with the previous grandmothers, but I think I work in community development, and I see households where you have adopted children or who may not know this history that someone could have who has that lineage. How do they know? How do you just think of all the multitudes of, first, if they were a foster child and placed in homes throughout the time and environment, what does that do during that time? And what are we doing to track that, or do we track that?
Sometimes you have records and sometimes you don't.
Exactly.
Right.
I have friends who have been through that, and I think, wow, if they really want to find out more about their, all what they can do, or what is preconditions, we may not know.
Yep.
And how does that play out with our rise in having, broken households or whatever that is that we're facing now?
Right. And I think, part of what that alarms to me is this sense of when our typical medical model is that we have this sense of control over our health, and that either it's through our choices that we make or our behaviors, and that this does call into question. Yeah, and that can feel a little unsettling. Any other comments?
I would be concerned if any of us took away a sense of fatalism about this information,
Right.
about how there are whole groups of people or entire communities that are beyond help. We're talking about having a strike against us in our genetic and early development, not being consigned to some kind of hopelessness, right?
Yes. Yes.
Both at an individual level and on a community level.
Yep.
I hope that's where you're going to take us.
Oh, well, thank you for saying it. And I think that's very important to reiterate. And it was mentioned in this kind of first hit, second hit idea, that while you may have various adverse environments when you're in development, that there's also this kind of first 1,000 days approach and what that second hit looks like. And still this is increased risk. It is not absolute. It is not deterministic. But I think this call to this kind of alarm or this sense of urgency is that, I think for some of the reasons that you brought up initially, is that it helps us to target our interventions a little bit more and to say, okay, well, if we know more about how chronic disease is developed, that it's not something that happens that we don't target behavior in adults, but really we need to target it much younger. That's really the point, not to make us feel like we're all doomed or our communities are doomed or our friends are doomed.
Are you looking at how industrialization has affected the quality of the health of mothers and infants? For example, the fact that we're oriented more towards convenience foods and packaged foods, and the foods that are being offered to us are much more highly processed, much less nutrient dense, and yet, the types of foods that are being marketed as health foods. So people think they're eating health foods like granola and things like that, and when they're really not. So that's an important. That's something that affects the whole population, not just subsectors.
Yeah, and I think that's an excellent point, because this is it's common lexicon and food systems language is that we increase food access, and that doesn't necessarily say anything about the quality of the food. So what we are careful to say is access to nutrients, access to nutrition, to really make that distinction. And when you unpack it, then it is getting into more of what does that actually look like.
One of the things that startled me this spring is when a surgeon came forward and talked about the real cause of problems in the health of people and cardio disease is actually inflammation, and that the inflammation is not caused by the wrong carbohydrates or the wrong oils. It's caused by things like corn oil, and what goes into corn oil is used for. That itself works as a corrosive in our arteries. And talking about just some of the foods, again, the access to certain foods, and the problem that we have in the structure of our food systems in the support of the corn industry for making it cheaper than apples.
Yes, there need to be a lot of people at this table, right, to be thinking about what solutions can look like. I'm going to take one more, and then we're going to move into the next.
And it just seems all of this makes me think that it's really the importance of planning public policy regulations. I mean, there are community responses, but you can get distracted on that as well if it's all just based on a community solving their own problems, right? I mean, so it's really, there has to be a focus on how we design, and what public policies are in place to keep us healthy.
No, that's absolutely right. And I think it's not in the absence of responding to short-term needs and to service delivery, but it's actually trying to really build that bridge between the two. And how can some of the issues that service delivery and community-based groups that are working on the ground, they really have a lot of information and they need to be circulating that conversation.
And when you look at the food that everybody's talking about, you have to look at the farm bill, and you have to look at subsidies, and what we do as a country that doesn't keep us healthy.
Right, like
And
WIC
that's-
policies
yeah.
and the SNAP program, yep. Okay, so now we want you to have a little bit of time to talk with the people around you or the person next to you. And we just want you to answer 2 questions. Okay.
Yeah.
I know, these are not sticky, not good walls. So, we'd like you to talk with the person next to you and answer, what does this information mean to my community, to me, and how can I relate to this? Which, we've already been doing this, this is already where the conversation's going. And where does this developmental origins intersect with the work that you are doing in your lives and in your communities? So we'll take just about 2 minutes per person, and then come back and I'd like to hear from you guys.
We're ready to start
Yeah.
our conversation.
Introduce
yourself.
Great, I love the energy in here. Lots of talking.
That's the best, and I hope you were actually all talking about the questions next, about how great the conference is overall. So let's just start with, what does this mean to my community? Who wants to share? I know everybody had lots to talk about, so. Anybody? Yeah?
We talked a little bit about community stabilization in the face of gentrification, how one could allocate more public resources to making places that are getting more expensive still accessible to the households that have lived there before they were gentrified, avoiding dislocation. But it goes back to real resource questions. How do we encourage affordable markets for food? How do we increase the supply of affordable housing through public interventions that are underfunded today and really need to be more robustly funded if we're going to keep up with those gentrification pressures? We didn't come up with answers.
Absolutely. If you did, that would be great.
Yeah.
Anybody else want to share?
I think we talked about the intersection, cross-silo work, intersection of kinds of thinking.
Like what kinds of different groups were you thinking like cross-collaborative work?
Well, I come from health and
City
planning.
So kind of the importance of that? Okay.
So how do we start doing that? So we have this sort of idea. Somebody have suggestions to that?
We will be able to answer that in the next public hearing. So hold on, just think about that.
All right, did you have a comment?
Yeah, getting nutritional food out there and accessible is a big part of the issue, but how do we address getting people to change their own thinking about, I deserve better nutrition? I live in public housing, and we have an amazing food pantry where St. Vincent de Paul they saw the need in our building. We have 286 apartments. If we are at full capacity, 300 of us live there. And they saw the need, and they actually helped get our pantry to where they go to their warehouse. A woman, an angel by the name of Jackie, goes to their warehouse, loads up as much as she can get in her vehicle, brings it directly to our building. We get it in the pantry. We now have 2 sessions each week where people sign up to come and get amazing food, but there is still a heartbreaking number of people in the building that, oh, well, I'll let the people that need it more. And it's like, honey, I know you're buying Trader Joe's tuna for cats and eating it. And it's like, how do you even begin to address that? Not to add to the.
But that's, it brings up a good point of, we need an integration of all of these and really changing people's perspective on how to interact with food and building capacity within communities to be able to do that.
I guess one of the things that I thought was helpful, how I relate or what this is mean to me or to other people is that to bring science to bear on the recognition that we're not all just individuals and every man is an island, but that there is this, that the community is real and it exists and it's important, and I think there's a good part of our American population that would like to believe that community is a figment of our imagination, and that this is something that can help shift the conversation, that this is scientifically valid.
Really legitimizing.
Any other comments about how it's affecting your community? Somebody want to talk about how it affects you individually, or how you can think about what you can do about this on your own?
I'm not sure how this fits, but I've been thinking recently about hepatitis C and all of the people who grew up during a certain era that may have had blood transfusions that years later are finding out they have hepatitis C. And then thinking about what the treatment modality is. It's so very expensive and it challenges our society. So we had something that grew out of ignorance about not knowing about what would happen with blood transfusion and being able to transmit hepatitis C, and then trying to get our arms around something that's really big for a significant number of people. And it affects not only individuals and communities, but then in a larger sense, it affects people that are receiving Medicaid services, that affects us as taxpayers as well. And when we think about some of these gigantic health issues and where the origin of them and then what we do about them, it brings into question about whether we have the collective will and the resources to deal with an issue as big as that. So again, I'm not sure how that fits into the discussion, but something that's been on my mind.
Anybody else? Let's talk about how, oh, sorry.
I was going to say, for me, in the capacity that I'm in, working with lower income communities and mixed income communities, is to talk about nutrition in a different sort of way. I think, and it touches on why do I deserve good food or I deserve good food. I think that we talk to the point that a lot of times the competition is the media in terms of what's being flashed. But it's also around not only having good food, but understand what that good food does for you. I think sometimes answering the why, not just eat good food, but this is why you need to eat good food, and consistently hammering those points in, I think it begins to change people's understanding in a different sort of way. So you can't just say eat good food, but you have to tell them why you have to eat good food. And it starts across the board. We also talked about waste and how much people waste, even in food preparation. And that whole packaged versus prepare your own meal. When you have all of these other layers that are in place, there's a significant number of single female heads of household that live in subsidized housing. So with all the balls that they juggle, how do you then prepare sound nutritional meals for your children while you're doing all those other things that you do? So
when there's a dozen McDonald's on your way home.
Exactly.
Say that again?
When there's a dozen McDonald's on your way home.
And sometimes it's just easier to grab and go.
And that is part of that broader environmental how do we change the broad environmental food environment so that people can have access to healthier options.
I think that's actually a great segue into where your work intersects with this idea of developmental origins. It's a clear example of that right there. Does anybody else have something they'd like to share? How your work maybe does now or could, maybe after listening to us today, you can kind of see some areas where you could use some of this information in what you do? Yeah.
I run a small nonprofit called the Confluence Environmental Center, and we do a lot of this work. We partner with Oregon Food Bank, Oregon Schools, Portland Fruit Trees Project, among others, to address issues of food access. And I'm really excited to be part of this workshop because it's giving me a lot of ideas for future collaboration to potentially place some of my AmeriCorps members in organizations such as yours, in organizations such as Carlos's. He's at Kaiser Permanente. And just thinking, just kind of getting more boots on the ground because that's really where change is going to happen. So I'm hopeful that people will become aware of my organization and what we do because we're really trying to address that cross sector. So not just partnering with mainstream environmental organizations to address some of these issues, but partnering with some folks in transportation, community health clinics, and others to really move the needle on this. So.
I think that was really one of our hopes for this too, is that we're all kind of getting to know each other and seeing how we can share our work and our ideas. I know Monica's group she works for is fairly new, as is mine, the Moore Institute part. And so we are both always looking for ways to partner out in the communities to get the message out to people who need to hear it, people who can use it. Anybody else want to talk about how it kind of could intersect with your work? Yeah.
I do gardening and healthy food access in local housing. And so I'm already, getting healthy food out there, but definitely I could work on, thinking about the intervention and really focusing the program on pregnant women and young infants.
Great.
So I work with a Latino agency, and we do patient navigation for persons with chronic illnesses, most frequently diabetes. So in our support groups, we invite the families to come, and we focus heavily on nutrition, exercise for the whole family. So we're trying to kind of break that system by getting the kids involved early on, having discussions about what kind of food to have and bringing fun things into it. We have a short little class called Seed to Supper, and they actually get a little trowel and they get to plant something. They can put it on their windowsill. They don't need a garden. And then they can watch it grow, and the other classes talk about cooking and preparing and doing those kinds of things. So trying to integrate it into their lifestyles as much as we can on a long-term basis.
Maybe a little bit as Cindy and Kara's talking about the why too, and not just the you
Yes.
should do it. You ready to move on to next?
Yeah, we have maybe 2 more comments, let's say. I work for Watershed Council right now. I'm mostly here for my personal interest, but one thing that I try to do is bring these issues to the conservation and restoration communities and try to get organizations that don't talk about these issues to have this conversation. So in the networking aspect, in terms of bringing those conversations, if anyone's interested in talking to the Watershed Council community, I can help give connections to from the conferences for them.
Yeah, I'd love it if everybody came and gave me their file.
We're talking about the importance of collecting the narratives of young women, young mothers in the vulnerable areas, about their concerns about bearing and raising children, and using that information to drive policy.
Yeah, I love that. And that is really, there is a male piece to the DOHAD, but it's a much smaller direct impact than the female piece, the mothers passing on. So that's really, I think, the audience that needs to kind of hear it more and understand it. We already know that they're faced with numerous obstacles. And we don't want it to seem like one more. All right. Do you want to do the last section?
Sure. So, let's check what time it is real quick.
12:21.
Okay, great. So now is the time for your index cards. And we are asking you to answer a few more questions, and this is what we'd like to collect. So everybody grab those and grab a pen. If you didn't get one, let me give you one. And who needs one? Okay. Here. Would you mind just passing that back? I'm gonna walk back.
We do have a few markers if people don't have pens.
Oh, one more. Need another one? Yeah. And you need one as well? Okay, so, maybe have a piece of notebook paper and make a tray of this?
Sure.
Okay. Excellent, that worked
think
out
we
really
got
well. One extra? We good? Okay. So, as the title states, we're really wanting to translate this research into action. And so we're hoping that you guys can help us. You've already gave us some really good applications and the work that you're doing, but we'd love to hear a little bit more about what kind of our next steps are, how we can plan our next steps as in building this movement and really building a sense of urgency throughout the various sectors that was talked about and that we need to reach out to. So, it would be great if you guys could just spend a few moments on your own responding to these questions, and then we're going to collect them at the end. Da-da-da-da.
You're gonna have to read them too.
I will. Thank you. I wonder if there's a way I can
Put on the screen.
Can you type it into the computer and make a slide?
Does this?
Maybe.
Sorry for my typo, my pink typo. Yeah, I'll be Vanna for a while. And you guys have already, some of you already responded to this, but how do you see your organization as part of this movement and effort? What kinds of projects, programs, initiatives, interventions, solutions could be implemented? And again, you guys have already spoke to some of this, but think outside your own box. Think about things that you think could be really effective that you might not actually be doing or have a hand in. And then finally, who would you partner with to make these things a reality? So this is to try to help us identify people that we're not already engaged with. So again, we're looking at how do you see your organization as part of this? What kinds of projects or interventions or solutions could be applied? And then who would you partner with? And I'll hold this until the end of stuff.
Are you gonna collect names and organizations so people could continue to?
You know, that's a great question. So what are you talking about for this question?
Well, just.
If
there's
you
a
would
lot of
like, feel
people
free.
with a lot of great ideas, and it seems like you've got a coalition that.
That's
you
a
know,
brilliant
kinda like
idea.
to work together.
If
and-
you feel comfortable, please leave your name and email, contact information on the back or somewhere on the card. And I'd be happy to even type up these responses and send them out to the group. So if you feel comfortable with your email being shared as well, feel free to leave them.